Hi, this is the Modern Dental Assisting, this is the Dental Radiography Principles and Techniques, 6th edition, and Chapter 1. So this is going to be to introduce you to basic dental imaging, the terminology of that, the detail, the importance of dental images, and to review the history of X radiation. So the dentist is going to rely on you to capture radiographic images accurately so that they can properly diagnose from them. So it's called a diagnostic image. So they have to be of diagnostic quality every time you take an image. You're going to be responsible for documenting those images, the number and type, in the clinical record under a dated entry. It's important that you have thorough knowledge of radiation because it's a necessary component of patient care and because radiation is something that you're going to have to be knowledgeable about because patients may also ask you about the type of radiation that you're using and how much of it that you're using. So we're going to go over basic radiation terminology. The first word that we're going to go over is radiation. You need to know these terms, you need to understand these terms and be able to use these words fluently while you're talking. So again, the first word is radiation. Radiation is energy carried by waves or streams of particles. X radiation. High energy radiation produced by the collision of a beam of electrons with a metal target in an X-ray tube. We're also going to be going over how all of these words fit together, how radiation works, how to produce the energy to produce X-rays. You'll understand all of the parts and components of an X-ray machine and how to produce X-rays in that X-ray machine. So all of these words you will be using and they will make more sense when you're using them in terms and in sentences later on in the chapters. An X-ray, it's a beam of energy that has the power to penetrate substances and record an image or shadows on photographic film. And we can use photographic film or digital sensors to record an X-ray. Radiology is the science or study of radiation as used in medicine, a branch of medical science that deals with the use of X-rays, radioactive substances, and other forms of radiant energy in the diagnosis and treatment of disease. Radiograph. This is a picture, a visible photographic record on film produced by the passage of X-rays through an object or body, also called X-ray film. In practice, it's also often called an X-ray. So the doctor might say, hey, go take an X-ray of tooth number 8. That's not correct. X-ray is a term that refers to a beam of energy. You can't take a beam of energy. But you're not going to correct your doctor and say, oh, that's not the correct terminology. You're going to go with it and you're going to know what they're talking about. So the proper term for the physical thing that you hold and look at the tooth or whatever the picture is that you took or the image that you took is a radiograph, or an X-ray film is what you can physically hold. Dental radiograph is the photographic image produced on film by the passage of X-rays through teeth or the related structures. Because a radiograph can be of, a femur. It could be of someone's spine. But a dental radiograph is specifically of the teeth and the related structures. Radiography is the art and science of making radiographs by the exposure of film to X-rays. Dental radiography is the production of radiographs of the teeth and adjacent structures by the exposure of film to X-rays. So remember, when we add dental to it, it's just that we're only exposing the teeth and adjacent structures. So when you become certified in radiography, it's going to be a dental radiographer certification. So you will only be able to take X-rays of the teeth and the surrounding structures. So a dental radiographer is any person who positions, exposes, and processes X-ray film, but it's going to be dental X-ray film. An image is a picture or likeness of an object. So when we get an image of a tooth, it's a picture or a likeness of that object. An image receptor is the recording medium. An example of that includes X-ray film, which is the older traditional film that we take X-rays on, a phosphor plate, or a digital sensor. So what those are is a digital sensor is exactly what you think of. It's a bigger and bulkier than a piece of film, but it's what digital X-rays are taken on, and you produce the image right up on the computer screen. A phosphor plate is stiffer than a piece of film, but it is more like the size and shape of an X-ray film, and you have to process it through what looks like an X-ray machine. So it still has to be processed through a film processor in order for it to show up on the computer screen versus a digital sensor that automatically pops up on the computer screen. X-ray film has to be processed through a processor and go through several stages of processing solutions for the image to show up on the recording medium. So all three of them are processed differently for the recording on the recording medium for the image to show up. Imaging in dental is the creation of digital, print, or film representations of anatomic structures for the purpose of diagnosis. So we're taking these images for the purpose of diagnosis. We're not just taking X-rays willy-nilly for no reason. Now we need to make sure that when we're taking these X-rays, it's because they were prescribed by the doctor. You don't go in and decide to take an X-ray because you feel that patient needs an X-ray. These are prescriptions. So when a patient walks into the office and says, oh, I have a toothache, I need a prescription, you don't write that prescription, the doctor does, and you know that. So you also need to know that you don't just take an X-ray because the patient has a broken tooth. The doctor needs to tell you to take that X-ray because that is also a prescription. With the importance of dental images, in dentistry, dental images enable us to identify a lot of conditions that may otherwise go undetected. We can't see things that we can't identify clinically, which means that things that we can see inside the mouth. So detection is one of the most important uses of dental images. Like if there's a cavity in between the back teeth, unless it's really big, we can't see it with our eyes until it gets really big. With X-rays, we can see that. Periodontal disease is a silent disease. A lot of times you can't see the periodontal disease until it's very far progressed without the X-rays. So here are some uses for dental images. We can detect lesions or confirm or classify suspected disease like periodontal disease or decay. Localized lesions or foreign objects. So sometimes people get things stuck in their gums, and we need to be able to locate exactly where that foreign object is stuck. They can provide information during dental procedures, like those of you that have taken Mod 5 already and know that we have to take those working length X-rays during the endodontic procedures. That is one of the reasons that we take it for information during a procedure. We use panoramic x-rays for growth and development. To illustrate changes secondary to caries, periodontal disease and trauma, document the condition of a patient, and to aid in the development of a clinical treatment plan. So dentists should weigh the benefits of dental images against increasing a patient's exposure to radiation. So we always want to keep the exposures as low as reasonably allowable. So there are important factors to keep in mind when your patient is having x-rays taken. Like, do they need to have these x-rays? When was the last time they had x-rays? What is the least amount of x-rays that I can take to get the maximum benefit? So all of those things should be thought about before you take that x-ray. So with the discovery of radiation, William Conrad Röntgen, in 1895, he was experimenting with these vacuum tubes and these fluorescent screens. While he was experimenting, he noticed the screens were glowing. And even though they were several feet away from the tube, he knew that some mysterious ray was causing the screens to glow. And after replacing the fluorescent screen with a photographic plate, he was able to permanently capture images. He then placed his wife's hand on a photographic plate and exposed her to the rays for 15 minutes to show that he was able to permanently capture the outline of her bones. This event was also recorded as the first radiograph of the human body. You can look in your book in figures 1.1 and 1.2 in the text and see Röntgen and that first photograph of his wife's hand. So that's pretty amazing. Heinrich Gessler in 1838 built the first vacuum tube. They were used in the work of making neon lighting. And Johann Hittorf in 1870 used the vacuum tube to study fluorescence. He became the first scientist to calculate the electric capacity of ions. William Crookes in the late 1870s made many discoveries with tubes, including one that led to the discovery of the TV tube. So he even redesigned the vacuum tube and discovered that cathode rays were streams of charged particles. So the tube used in Röntgen's experiments incorporated the best features of the Hittorf and Crookes designs and was known as the Hittorf-Crookes tubes. Philip Leonard, 1894, discovered that cathode rays could penetrate a window of aluminum foil. It's thought that Leonard may have discovered X-rays if he had just used more sensitive fluorescent screens. So that's pretty amazing that just by using something a little more sensitive that the discovery of X-rays could have been by somebody completely different. So when he was using that thin window of aluminum built into the walls of the glass tubes, it would cause the fluorescent screens to glow as well. But he noticed that when the tube and screens were separated by at least 3.2 inches or 8 centimeters, the screens would not fluoresce. It has been postulated that Leonard might have discovered the X-ray, like we said, if it was more sensitive, if he had used more sensitive fluorescent screens. So a lot of them were onto the same things around the same time back then. So we're going to stop right there for today, and we're going to pick it up tomorrow with these pioneers in dental radiation. Thank you.